Right. Well, welcome to the Maine Recovery Council monthly meeting. First of all, for those who are here and also members of the public, I'd like to apologize. We're having some technical difficulty. So I don't believe you'll be able to see us. You will shortly once we fix that, but right now you won't. But you will be able to see some of the slides that are going to be in a presentation going on. Again, be patient with us and we will hopefully have that fixed before the end of the meeting, or at least some minutes in. I will remind you, thank you all for coming, but I will remind you that all of our meetings are public, as well as people can come in via Zoom or the computer. So I'd appreciate if when you did speak, if you would speak up and also say your name so that they get to become familiar with the voices of people here on the council. We also have two members, Betsy and Tina coming in today via Zoom, and we will talk more about the ability of people coming in Zoom later on in the meeting. So again, I welcome all of you. At our meeting in June, was it June? We had a presentation from the Department of Health and Human Services on where they were, and Director Squirrel came with some really valuable information. But you also had some questions for her about some other data that she had, and she has graciously agreed to join us today because she's a busy lady with a busy schedule. She is asked to be placed to the first part of our agenda so she can get to another meeting. So at this point, I am going to turn it over to Director Squirrel. Thank you very much for coming.
Thank you. Good afternoon, Sarah Squirrel, Director of the Office of Behavioral Health. Very happy to be here today with all of you. As Pat mentioned, there were a few follow-up items related to the last presentation that the Department of Health and Human Services did. Wanted to make sure that we provided that follow-up information to the council. So I will jump right in. There are copies of the slides for those who are here in person over on that table, and an updated overview of the SUD residential treatment beds, which was one of the follow-up items as well. So these were the four main follow-up items that were requested by the council. We had prevented a slate of CDC prevention activities that did not have funding amounts attached with those. So we've updated that information to have the funding amounts included. We also had some recommendations for consideration for the council in terms of use of funding potentially to support our ongoing opioid response efforts. We have updated those amounts with specific funding amounts, in addition to council members asking us for recommendations for prevention-related opportunities to utilize Recovery Council funds as well. There were questions related to the Office of Behavioral Health State Fiscal Year 24 and 25 budget initiatives. So we've provided a bit more detail on those, even though it feels a bit in the rearview mirror, given that that funding has been approved for the department, but good for the council to be aware of how we were thinking about the utilization of those funds. And then there was a request related to our overview of SUD residential treatment beds across the state. Some really good questions from council members around, okay, this is a great list. How many of these residential treatment facilities are accepting Maine Care? Where are the adolescent beds? So we have updated all of that information. That is on a separate PDF because there's so much information in one place, but we'll chat a little bit about that as well. So those were the four items I was going to brief the council on today. So this first slide is similar to what I shared in the last presentation. We provided kind of the slate of use of SUD funding for the Office of Behavioral Health. And also noted that our partners at the CDC hold a lot of our primary prevention work as it relates to opioid response. We had presented this slate of activity that the CDC is engaged in. It did not have funding amounts. It did not reference specifically what federal grants we were talking about. So we have updated that slide to indicate those. I apologize for the acronyms in the funding line. We were trying to get everything to fit on one page. But for those who don't know, these are both federal grants. The PDO is the Preventing Drug Overdose Grant, and SPF is the Strategic Prevention Framework Grant. So that's direct funding that goes to the CDC that they utilize to support prevention work across the state. All in all, it's about, I think, $1.2 million in annual funding. You can see that we have broken it down by each of the activity areas here. And I would just note, one question you might have as council members is, how consistent is this funding? Can we count on it as a state annually? These are competitive federal grants, so we do have to compete every 5 years for these grant funds. Some years we get a little bit more, sometimes we get a little bit less, but in general they're fairly consistent. But just to preface for the council, these are competitive grants. So I will pause on this slide and just see if there are any questions as it relates to some of the Maine CDC prevention work.
No questions, but thank you for breaking that down for those 1-year grants, and that's great. Thank you.
Yes, of course, no problem. And if there is any, sometimes I do my best thinking reflectively. If there's any questions that council members have as it relates to some of these activities, feel free to shoot me an email. We're happy to follow up or to have CDC follow up to provide more detail. Okay, one of the other areas that we included in our presentation to the Recovery Council was some of the priority areas that we were really looking at in terms of furthering expanding our incredible work that we've accomplished here in Maine as it relates to opioid response. And those strategic opportunities for use we have broken down into 2 priority areas. Priority Area 1 is the expansion of opioid response activities with demonstrated impact. Priority Area 2 is focused on prevention activities, which is on the second slide. When I last presented this slate of potential opportunities for the council to consider, they did not have funding amounts attached to them, so we have provided some funding amounts as potential benchmarks. The presentation was absent of prevention recommendations, so I'll be sharing more information on the prevention recommendations as well. But just to review this slate of opportunities with the council, and also just to preface, we have looked at the eligibility criteria for the use of Recovery Council funds, and these do align with the use as indicated in those documents. So one opportunity that we see here in Maine is further expansion of our crisis receiving centers. When we think about crisis receiving centers, I think about it in terms of what is the problem that it's trying to solve. And the establishment of crisis receiving centers in Maine is really to provide same-day, walk-in, low-barrier access to substance use and mental health services. That's inclusive of peer supports, clinical supports, same-day access to medication for opioid use disorder. They're comprehensive services. That's inclusive of crisis intervention, de-escalation, counseling, psychiatric services, case management, pharmacy services, peer support, and referral to other services as well. I would also note that there's a 24/7 component to our crisis receiving centers, which is also critical. We've been very successful in establishing the first crisis receiving center in Maine in Cumberland County in Portland, working with our partners at Spurwink. We're just over a year into implementation, and I can share some of the data as it relates to that implementation. We also have a whole separate presentation on crisis receiving centers if the council should ever be interested and want to dig into some of that outcome data. But just, from some basic data, on average, the Crisis Receiving Center in Portland is serving just about 200 individuals per day. About half of the individuals who are receiving that kind of access to same-day service, their presenting issue is resolved in 1 to 2 visits, which is what it's intended to do to really divert from law enforcement, ED utilization, et cetera. 91% of the individuals who receive services at the Crisis Receiving Center does not result in any form of hospitalization whatsoever. In addition to that, we have seen a significant amount of behavioral health calls to the Portland PD that have been diverted. of which 43% would otherwise have had to go to the ED. So we think about, the efficacy of this model, the success of the implementation. Is it achieving the goals that we had originally set out to do? And we would say yes. So we really see an opportunity to potentially scale these crisis receiving centers up statewide in areas of the state that are underserved. Courtney.
Dr. Sproul, you might have just said this, but did you see that there is Cumberland County operating 24/7 now?
They are operating 24/7 with on-call nurse practitioners. So it did, as you can imagine, given current workforce challenges, having any facility operating in a 24/7 basis, particularly as it relates to nursing, is very, very challenging. So it did take the facility some time to actually be able to provide that 24/7 access. And so we've been working with SPURWINK around the staffing model, what is appropriate to have on call. You need medical personnel available in terms of appropriate medical clearance. So they are accepting individuals overnight, but some of the nursing functions are on call at this time.
Wonderful, thank you. I love the crisis receiving centers. I think that they're phenomenal. Would it be accurate to say that these centers might be serving people who would traditionally kind of funnel in and out of our county jails?
That's exactly right.
Okay.
Yes, and I think that's being, borne out in terms of the warm handoffs from law enforcement. Almost all of those are managed within 10 minutes or less. We had, in speaking with the Portland PD, there have been individuals who were showing up so often on their overdose reports on almost a daily basis. They were connected to the crisis receiving center, and the Portland PD was so concerned that they'd stopped showing up on the overdose reports, but it was because they're getting access to that same day service.
Wonderful, I
Yeah.
love it. So people get access to the treatment and recovery support services they need, and we decrease the county budget for people going in and out of the county jail. Thank you.
Yeah, and I think, one of the other aspects of the crisis receiving centers that's so unique is we're actually blending together 3 best practices that are evidence-based from SAMHSA's perspective. It's this kind of drop-off area, for law enforcement, referrals from emergency departments. It's same-day access to crisis resolution, in addition to trying to develop more of a living room model, which is really about peer support and in creating an environment that is warm and welcoming, doesn't feel institutional, because we want people to feel welcomed. We want them to walk through those doors. We want them to come back the next day if they need more support. And if you hadn't had an opportunity to visit the Crisis Receiving Center in Portland, I would strongly suggest that you do. And I'm sure Ben Strict, who is our clinical director, would welcome that as well.
In your funding pieces here, you said $500,000 to start up and 2.5 operational, and you said 2 additional. Is that the total that you would need for 2 additional?
That is per center.
Per center, thank you.
And that is based, the business model to some extent is based on the Cumberland County Crisis Receiving Center. Obviously, some of the budget would be determined by the community that it's in, the population base. So that budget, could shift in different directions. I would also just note how important those startup costs are for kind of capital expenses and establishing the building, in addition to ramp up for staffing. I would also note that what's key to sustainability for the crisis receiving centers is the ability to maximize Maine Care revenue. So that also took some time for SPURWINK to really lean into. I'm happy to report that I think the last report we saw from SPURWINK is that they're leveraging close to $800,000 annually in Maine Care revenue, which is offsetting the overall costs of the program itself. But for any new program, it would take them some time, to really ramp up that Medicaid billing. And then, of course, there's the, longer term plan of, how do we work with Maine Care to eventually, develop a rate that would support crisis receiving centers, because we really saw this as a pilot, so we could test out the model and see how it might work. Chastity.
Where it says 2 additional, is that going to be, are we looking at urban areas or rural areas?
I think it could be a both or a both and. We certainly know that there are needs in other urban areas, and we certainly know there's a lot of unserved need in rural areas. Rural areas would be a different kind of implementation. Obviously, Cumberland County, we would not consider rural. But certainly, that would be a conversation that the council could have as well in terms of determining, what communities would really benefit most.
Do they do medically managed withdrawal services?
I don't believe that Spurwink is currently doing medically supervised withdrawal services. It doesn't mean that it couldn't be incorporated into the model, though. But I can follow up with Ben.
Sarah, how do you see the intersection of CCBHCs and the crisis centers?
Yeah, that's a great question. We've been grappling with that a lot, particularly as we're in the process of developing the service delivery model for CCBHCs. I think we're trying to be careful because these crisis receiving centers are so unique and comprehensive, and we want it to be sustainable. And at the same time, we want there to be an expectation as it relates to our rollout of certified community behavioral health clinics across the state. They're also providing same-day access and urgent care. So I think we're trying to balance what is an appropriate expectation for early implementation of CCBHCs. Maybe that's a more pared down kind of urgent care model, same-day access. The crisis receiving centers kind of remain, a unique specialized program that can serve a larger geographic area, but certainly something we're taking into consideration.
I'm sorry, one more question.
Of course.
You said that most of the patients have their needs met in 1 to 2 days. Does that mean that they are referred on to other outpatient treatment programs?
It could be, yes. It could be, they had kind of an acute thing happening for them that they needed some immediate support around. They could be referred to other community-based services. I mean, that's the beauty of the model being embedded in the community. They're working with other community partners. And again, we have more comprehensive data as it relates to the true breakdown of those visits and then disposition post visit to the crisis receiving center that we'd be happy to follow up with the council on. It is not available online, but I'd be happy to share it with the council. Okay. Item number 2, continued expansion of naloxone distribution. This has been a key area of our opioid response. Already to date, since 2019, we've delivered over 300,000 doses of naloxone across the state to reverse over 8,000 potentially fatal overdoses. We continue to expand and increase our naloxone distribution across the state. Maine has actually been recognized for our distribution in our model. We actually have a team going down to Maryland next week that was invited. Just 10 other states were invited. Director Smith will be participating in that meeting. So always opportunities to provide more funding to continue to support our naloxone efforts and distribution across the state. Implementing an anti-stigma media campaign. Oh, yeah.
Just a quick question.
Of course.
Because I come from a law enforcement background, right? So I don't really know, but there are a number of areas where folks can get free naloxone.
Correct.
And how do we distribute naloxone to like local rescue services and things like that? Like not necessarily the commercial ambulance services, but the charge for services, but those locally funded first response.
Yeah, so we have tier 1 and tier 2 distributors across the state. We also have other partners who are working at the community level that are making sure that naloxone gets to local community resources. That's inclusive of our options liaisons. We've actually launched a new program this year, which is peer harm reduction navigators. They're also community-based, providing naloxone to community-based organizations. So I feel like it's fairly comprehensive. I don't know, Gordon, if there's more that you would add to that.
The EMS thing is complicated. And I've had some complaints from some services that they have to buy it, others are getting it free. I really need,
we have huge numbers there in their leave behind program, but as of the end of December, they all have by rule and Department of Public Safety, they all have to participate in the leave behind program. So it may be that that Director Hurley, Sam Hurley, and I and the network need to sort that out. We just did had our first meeting yesterday. Not to digress into this, but it's fair to say that we almost operated for the 4 years on the basis that we had unlimited supply. And we just bought a ton of it, 334 doses. And so we almost denied no one. Well, now we find a lot of hospital systems that don't want to. And we know if we do that, that we may not have it available for other potentially more compelling needs. And it also gets complicated because some of the services do not in that, do intermuscular, like the syringe exchanges, the hospital should be intermuscular versus the nasal, because it's far less expensive. And right now we got some stuff to escape. Some people feel it's even more active. So so in order to deal with supply, under the leadership of Dr. Benson Yang and Director Squirrel Shaw, we started a committee to look at the priority, recognizing that we're not going to have unlimited supply. We have to now. There's some that are different than the naloxone, also intranasal, and we think the competition will drive down the cost somewhat. There's already, when we started in 2019, it was we were paying $75 for double dose. Now we pay $47.50. That should continue to come down, probably too, because as you know, it's going over the counter. So for all those reasons, it's time to sit down with this priority. So I can't specifically answer the question on the EMS, although I should be able to. We will have an answer.
Thank you, Gordon. That was really helpful. The next item is implementing an anti-stigma media campaign. I think Gordon has shared with this group more information as it relates to Shatterproof and opportunities there. We've been very, very focused on expanding our residential treatment beds across the state, specific interest in more medically supervised withdrawal beds as well. The council is aware that we have made available $6 million in capital and catalyst funds over the past year. That has resulted in the addition of 140 new beds, which is exceptional for our state. We also just released another tranche of capital and catalyst funds, $2.3 million that was publicly, that RFA went out in May. It closed in June. We do expect that there could potentially be more demand for funding than funding is available. So another area for the council to consider is additional funding to support further expansion of SCD residential treatment beds and medically supervised withdrawal beds. Courtney.
Thank you, Dr. Squirrel. So LD 1719 was included in the budget, which is the bill by Speaker Talbot Ross for $3.6 million for a we called it a treatment center, a detox in either Washington or Kennebec County. But now hearing more about the receiving centers, there's also a clause in the bill language that says that it will be both a detox center with at least 10 beds and also, quote, a receiving center that is open 24 hours per day, 7 days per week, to provide SUD treatment while a patient awaits higher access to care. I don't think we have the language of receiving centers, but it like crisis receiving centers, but it almost sounds like a hybrid model between crisis receiving centers and detox in the same space.
Yes, and I think, I could be wrong, but I think the amount of funding that passed was closer to 1.6 million. With
it was 1.6
with
different years, so that's 3.2, and then 400,000 for stand-up, so 3.6 is total.
Thank you, Ben. And so, yes, I think that's correct. And I think one of the areas that I was just wanting to think more about with that is that we wouldn't want to water down the model of a crisis receiving center, and the budget for a crisis receiving center to really do it well is more than the 1.6, which is why we thought perhaps this could be a both and. We could establish a more traditional SUD treatment facility in one of those regions and potentially think about also adding a crisis receiving center as well.
I just want to tell you, you have to leave by 2:30.
Yes.
So I'm going to just say,
Okay.
you're welcome to come back after your call, but if you want,
Thank you.
again, just for your time, I know that you had to go.
Yeah, and I want to make sure that I get to prevention. So the last two here are implementing mobile MUD units statewide. This could be both mobile units related to buprenorphine. We have some providers in the state, I think Enzo in particular, that are interested in exploring that model. And then we're also doing our due diligence to look at mobile methadone units. Massachusetts is doing some work on this. Catherine Coutu, who is our mental health or substance use manager, is actually going down to see their programs and to see potentially how they work and what the opportunities might be for Maine. And then, of course, we had an extensive conversation at the last council meeting about the need to expand access to MOUD for incarcerated individuals. So opportunities there as well. Let me move us on to prevention. So two areas, and just want to give credit to our colleagues at CDC for really honing in on these two opportunities to recommend to the council. I know how much of a priority prevention is for this work and how important it is. The Maine Prevention Network is kind of CDC's network of prevention partners. They work in 9 public health districts across the state. Last year, the governor directed us to use about $1 million of our opioid prevention and treatment funds to scale up programming in middle schools, which we have successfully done. There is the opportunity to expand that even more potentially by leveraging some of the resources within the Maine Prevention Network as that work advances. And then I also wanted to note the potential to expand Youth Expert across the state of Maine. That acronym is Screening, Brief Intervention, Referral, and Treatment. Right now, Maine CDC is piloting Youth Expert in 4 of our school-based health centers across the state. We are utilizing, again, opioid prevention and treatment funds. And Youth Expert is really focused on preventing and reducing risky substance use behavior, particularly for adolescents. Screening is provided to really identify where a use might be on the spectrum from non-use to problematic use. Brief intervention can be provided to the youth to provide, just information and awareness, support behavior change, and then, of course, referral to more comprehensive treatment. So we would recommend that there's an opportunity to expand this work even more broadly across the state. Currently, that work is happening in Penobscot County and Waldoboro, Newport, Maine, and Oxford Hills. And pairing it with a school-based health center is really smart because you already have embedded mental health and substance use services in that community. So again, just another opportunity for us to go further upstream and support our adolescents. And I think, yes, one more, and I can just leave this as information. So there was a question related to, we had a budget initiative for $3.7 million in both state fiscal year 24 and 25. This was really just to continue the work that we're already doing across our spectrum of substance use disorder services. We have seen an influx in federal funds, which has been great. We also have to plan for the sunset of some of those federal funds. And we've expanded our opioid response activities exponentially across the state of Maine. So this funding was really critical to keep that work going. So I provided more of a breakdown here for the council. And last but not least, I do want to make sure that I speak a little bit to the updated list of SCD residential treatment providers across the state. Thank you so much. Very hard to read on the screen. I apologize. We try to get all the information in one place. This was really kind of what's kind of at the top of this sheet is like current state, all of our residential SUD capacity across the state. And below the line are the new beds that are coming online. And Our previous overview of this did not include adolescent treatment beds, so they have now been included. In addition, there were questions about, well, who accepts Maine Care? Because when we think about access, having these providers accept Maine Care is critical. So you'll notice in the far right column, we have noted whether the facility does accept Maine Care or does not. We do have a couple of private facilities that still do not accept Maine Care, but largely most of our providers do. Obviously, receiving any of the new capital and catalyst funds, you're required to make sure all of your beds are open to Maine Care. I would just note that there were some good points made by council members in terms of historic practices of maybe residential treatment providers having only a certain amount of beds available for Maine Care. I think one of the pieces that has mitigated against that is we've increased rates by almost 70% in the past 3 years. So there's much more of an incentive for these treatment providers to accept Maine Care. So I think that's the extent of my presentation for this afternoon.
Thank you for your time, and I know that you have a 2:30 call. So if you have any further questions, I'm sure we can, if you get them to me, we can filter them, and get them to Director Squirrel and get those answers. And as always, you're always welcome back to share where the department is and what work that you're doing and how we can work together.
Thank you. Thank you, everyone.
Thank you. And the list of, where we can spend our money. It's a good list. Thank you. All right. Is Betsy on too?
Betsy's not on.
She's not on, okay. So can you take minutes until Betsy?
I usually take them after
Okay.
the recording.
Thank you. All right, thank you, Director Squirrel. All right, back to our agenda. So I'm going to go somewhat in order. So the first item on our agenda is to vote on the minutes of January 8th.
Oh, Betsy's on, but she's not on as a panelist.
Hmm?
Betsy's watching, she just didn't, she
Oh,
didn't.
she
enter
just
the
didn't
meeting.
link in,
Yeah,
but
she
she's watching?
didn't enter the meeting as a panelist. So
Okay.
we can't see her, but she's here.
All right, thank you. All right, and this is our first time of putting our members on Zoom, so if I, please speak up when you need to, or wave at me if I'm not paying attention, so we will move through. Okay, so you all should have got a copy of the January 8th minutes, and I'm looking for a motion, a second, and discussion on those. June 8th.
So moved.
It's been moved. Do I hear a second?
Seconded.
It's been moved by Ben, seconded by Gordon. Any discussion on those minutes? If no discussion, can we take a vote? Now, we have two members on the Zoom. Do we have to go down the roll? Okay.
Yes.
Technically, we only have one member on Zoom, because Betsy's not. Betsy can't be seen or heard, because she didn't join as a panelist.
So can I ask you, Kelly, can you go through the roll when we vote on things?
Yes.
Okay, thank you. So it's been moved and seconded. There's no further discussion, so I'm calling for a vote.
All right, Liz Blackwell Moore, Todd Brackett,
Yes.
Lydia Krafts, Joe Everett,
Yes.
Betsy Fitzgerald, Courtney Gary Allen,
Yes.
Pat Kimball,
Yes.
Ben Mann,
Yes.
Bruce Nodden,
Yes.
Miles Olet,
Yes.
Eric Small, Gordon Smith,
Yes.
Tina Thacker.
Yes.
You're muted. I saw you try to respond.
She said, can you do a thumbs up?
Yes, thank you.
There we go.
You might not be able to hear her. Chastity Toole,
Yes.
Toole, Paul Vinzel.
Yes.
So that's 11-4 passes.
All right, so if there's no opposed, no abstention, then the motion carries, and thank you very much. All right, so I'm gonna go a little bit out of order and go to the governance committee. meeting. So the governance committee met, and the governance committee takes minutes at that meeting, and they are voted on by the governance committee, and we will make sure that once those minutes are voted on and approved, that they go on to the website so all the membership can see those. But it's not necessary that the whole membership vote on those minutes, so that was on. So the main goal of that meeting was to discuss what we were going to do with the tie vote with the vice chair position for the board. There was a discussion on that, and because this is a position that will only be until the next vote, which is at the annual meeting, which is the first meeting of 2024, the governance committee is recommending that we leave the vice chair position vacant until the annual meeting in 2024, and ask Courtney and Eric to serve as members at large to the executive committee. And that is the recommendation that the governance committee is having to go before the board. So do you have any questions in regards to that?
Did that get run by Courtney?
Matter of fact, it was Courtney, I believe, who made the suggestion.
I can speak to this.
Yeah.
I offered this to Pat and to the governance committee because I thought that it was important that everybody is heard. We did have a split tie, 6-6, which means that there has been kind of conversations that quote unquote, there's a division in the council. And I wanted to kind of squash that. I don't think that there's any type of division in the council, and I think that both myself and Eric are great leaders, and that both sides of the quote-unquote division should be heard, and that that means that there is an opportunity for Pat to appoint us both as at-large members to the executive council, executive committee, and both sides can kind of have that and move forward so that we can get this money out to the communities that need it.
And unfortunately, I wasn't at the meeting, which made for probably a split.
Well, actually, you know, it was gonna happen sooner or later.
Well, mine was just right on here.
I actually, no matter what, there wasn't enough votes for either Eric or myself to be appointed as the vice chair, because this council has to operate as a 3/5 of this body must agree to move forward. So no matter how the math worked out, and Eric and I didn't want to spend our time trying to like lobby each other's votes to get this done. We both really want to make sure that this money gets to the communities that need it and move forward.
And it's a temporary, it's a really good solution. It shows a compromise and a willingness for the committee members to compromise. And again, if we have to elect new officers at the annual meeting, which is the first meeting of 2024. So we thought, for the sake of moving forward and recognizing both the leadership of Eric and Courtney, this was the best solution. So, do we need a vote on that?
I don't think so.
Okay.
Unless anybody disagrees.
Unless somebody disagrees, that's what is going to happen, and I will appoint Courtney and Eric to the 2 members at large to the executive committee.
That may require a motion.
I think it's
No,
a,
that
that is
With the
besides.
approval of the council.
I think we discussed it, and I think it was,
I'm pretty sure it's just Pat saying.
I think it's
It may
me.
be different for the executive.
There's way too many just me's. I don't like that.
I'm
So
doing it by memory,
it's
but I-
as determined by the chair with the approval of the council.
Oh, okay.
All right, so,
I move the council approve the recommendations of the chair to appoint Courtney, Gary, Allen, and Eric Small as at-large members of the executive.
so moved and seconded. Any other discussion?
It has to be a roll call.
Yeah, we have to vote. So Kayla, can we do another
Yes.
roll call? Thank you.
Liz, Blackmore, Todd Brackett,
Yay.
Lydia Crafts, Joe Everett.
Yes.
Betsy Fitzgerald, Courtney Gary Allen,
Yes.
Pat Kimball,
Yes.
Ben Mann,
Yes.
Bruce Nodden,
Yes.
Miles Olet,
Yes.
Eric Small, Gordon Smith,
Yes.
Keena Thacker,
Yes.
Chastity Toole,
Yes.
Paul Vinzel.
Yes.
All right, all in favor, motion carries. Thank you very much. All right, now, the discussion on remote meeting policy. So the governance committee met, and we have a draft on the remote meeting policy.
Do you want me to take over?
Please, thank you.
My memory of the governance committee meeting was that the committee requested changes to the remote meeting policy. Just to back up, the remote meeting policy currently permits members to participate remotely when either they or someone under their care has an illness or generally needs to be cared for, or if the member must travel a significant distance, or as a reasonable accommodation for disability. The member who requests remote meeting participation, makes the request to the chair, and the chair makes a determination, whether that would be okay. And that's, it's not spelled out specifically in the policy, but you can read it to suggest that that would be on a meeting-by-meeting basis. I think it's also possible to have kind of a standing request, based on those criteria. My memory of the committee meeting was that the committee requested a policy that was generally more permissive of council members participating remotely, so that they could participate remotely at any time without having to notify the chair or anybody else. And so really just upon their individual election, based on, really just upon their individual election. So if I've characterized the request from the committee accurately, the draft in front of you tries to incorporate that and basically makes the following changes. Section 2A now says that the council can meet fully remote if the council chair determines, after soliciting input from the council itself and subject to the council voting otherwise, that one or more council meetings may be conducted solely by remote methods. The other option is the one I just described, where members elect to participate in a particular meeting using remote methods. And it would be as simple as that. The Attorney General's office, when setting up meetings, would distribute, of course, the person I need to sort of consult with about this has left the room, that's Haley, but my understanding is we would, with every meeting, circulate or otherwise make technologically available to the members, as Dr. Thacker is now, and ideally Betsy Fitzgerald would be in the future, be able to participate remotely. I'm not sure that there's anything that a member would have to do. I think the access would be available to them sort of automatically, and to the extent there is, an issue with getting on technologically, you could just, get in touch with us, ideally that morning or the day before, and we will, hook you up, walk you through the process. But the concept is, at any given meeting, unless it's fully remote, there would be an in-person physical location for the meeting. Those who wish to attend in person can do so. Those who wish to attend remotely can elect to do so. And the council will go forward with its meetings on that basis. The the policy generally, the policy also applies to committee meetings, unless the council wants to make a different determination about that, but it's written right now to apply also to committee meetings. And so I provided a draft for the council to review. My suggestion, unless this typically would go to the governance committee, I think. The governance committee could then, make whatever recommendations it wants to make to the council, and then the council can act on the governance committee's recommendation. An alternative approach could be the council could be prepared to vote on this at its next meeting by taking this draft, sending comments to me. If there's anything that requires, significant discussion, I would notify Pat, and she and I could discuss, whether it would need to go to the governance committee, in which case we would not go on the next agenda. But what I've heard, I think, from the governance committee is that it would be great to do this as soon as possible. So my suggestion is we could skip the governance committee step and go right to the council meeting. Gordon?
Is there any compelling reason legally why we couldn't adopt the policy today?
Let me just speak to that for a second. The short answer is the existing policy that's in place currently states that it may be amended as needed by a 3/5 vote of its members, and it would take effect immediately upon adoption. And normally, that is what I would recommend. However, in revisiting this issue, and you may recall, we were doing things quickly at the beginning of the council's existence. We were trying to get things in place so that it could operate. Having revisited the statute requires the policy to be adopted when there's sufficient notice and a hearing is the language of the statute. My concern is that a hearing means a public hearing, an opportunity for the public to speak to that issue, as opposed to merely a meeting. I haven't spent a lot of time analyzing the legalities of that issue, but my recommendation to the council would be, for belt and suspenders purposes, I don't know that anyone's going to challenge the remote meeting policy, but my recommendation to the council would be, at the next meeting, have an opportunity for a public hearing. We put it, we notice it as part of the public notice for the next meeting, and then it gets adopted. In the meantime, I would suggest to members that they take advantage of the existing opportunities under the existing policy to notify the chair if they feel like they have to drive significant distances, for example, to participate remotely. So that's my thinking at the moment.
So I have a question. So if we have to have a public hearing for change in policy, so we didn't have.
Let me clarify.
Okay.
The statute states that you need to have a public hearing to adopt the policy. At the last, when the council adopted the policy, we had a meeting, we publicly noticed it, and we had a meeting, but we didn't have a hearing. And so, my concern is that it would be better from a lawyer's perspective to be careful about it, have the hearing, and then if there's any doubt whether the council has properly adopted a remote meeting policy, then we can at least say that at this one we have.
If we have meetings remotely, will the public still be able to participate or be able to, there'll be a link for them?
Yeah.
You'll look like Kina on my screen, so the public can still all see that Kina is up there right now. Like when they log in, they see both us in that box and Kina in that box. So there'll just be a bunch of you on there, and they'll watch you on there instead of.
And I serve on a committee, Board of Visitors, where the public's notified, and we meet totally remotely. Because of COVID, we haven't gone back to meeting in person, and the public has a Zoom, just like they do here. They just come in via the Zoom, I mean, it's possible, so.
I just want to make sure that the public hearing is focusing solely on the remote policy. There's no other.
Correct, and we can time limit that policy. Say that we'll have, no, you can't, can we?
Oh, the discussion.
Can we limit this?
I mean, I could look at that issue. I can't say that for sure.
Okay.
There's nothing in the statute about the remote meeting policy that requires any particular time period. It just says a public hearing. It just says a hearing.
And the only reason why I'm bringing that up is that when you say public hearing, you know what's going to happen.
Yep.
Courtney, and then. Sure, thank you.
I just wanted to clarify and make lawyer sound less lawyery and make it more sound like layman's. Just for clarity, I can call Pat as of now and say to her, I live in Washington County and I can't drive all the way down for a 1.5 hour meeting.
Correct.
And I can participate on Zoom.
Right.
And it's Pat's discretion whether to permit that.
Okay, thank you.
And more than listen, full participation.
Yeah, we just need enough notice so that Haley can get you, I mean, I think right now it may even say, right now, I just need enough notice so Haley can give you the information so you can link in. And that's it. So we can, right now, with the current policy, totally come in via Zoom. And my concern is that I just wanted to get it clarified because we're gonna start doing committee meetings and people can't keep driving, 2 hours in a car to attend 2 meetings a month in order to move this forward. So that's where my concern is with that I just need to get it going and to be able to make it visible for people, to be able to be convenient for people to participate. Very busy people on this committee are very busy people, so.
And make sure whatever email you want your invite sent to, so when you participate like that, I'll have to send you a panelist invite, so you won't use the regular Zoom link like the public, but it will authenticate your email, so whatever email I invite as a panelist, it's gonna check your Zoom account against that, so if I have a work email right now, but you wanna use personal or vice versa, just let me know which email to send the invites to.
I don't want to belabor this too much longer, but it says such determination shall made sufficiently in advance. I know each should be there, but I'm just thinking of a scenario where there's like a huge snowstorm or something. Is that sufficient to say, let's say that the night before or during the day to say, hey, we're gonna meet remotely solely?
Yeah, I think we would probably have to figure it out on a case-by-case basis.
But that's sufficient.
If there's a huge snowstorm,
Correct.
Brendan, I might not even be here. so-
Rather than cancel a meeting,
Yeah.
we can make it, we know that the blizzard of 2024 is coming. We can go totally remote, or heaven forbid, we have another pandemic, I'm not gonna say that.
I mean, in that scenario, we would already have noticed the meeting and we would already have included a Zoom link for the public to participate. So,
And I'm sorry, but it could be like the night before.
yeah.
Correct.
But sufficient
Correct.
covers that, that's all I'm asking.
Yeah.
When schools start canceling, we can do it. All right, so,
Just quick, I don't have a question on the substance of the remote policy, just the process around it, because I don't know what other policies we might be adopting that we need a separate public hearing versus a public meeting, which we are in right now, but Brendan, perhaps you can look at that when we reconvene on, because I do think it is likely sufficient that we want to preserve transparency and provide feedback opportunities for everyone that is interested in this, but having a public meeting with the documentation already submitted, in my mind, is sufficient to move this forward at this point. I don't know what else might actually come under this purview besides the remote meeting policy, but I just don't want this, in case this comes up in the future for future policies, it might be good to try to clarify that in the next meeting.
Clarify What exactly? Sorry.
I guess just maybe the difference between a public
Yeah.
hearing and a public meeting, and if what we're doing sitting here today sufficiently checks the boxes of providing the public and anyone interested in providing feedback into the topics that we are going to discuss and decide on. I'm on island on that. I'm happy to.
No, I think it needs to be clarified. Okay, so if I'm not mistaken, so you move forward, this policy will go back to governance?
Madam Chair, just a quick point.
Oh, sorry.
That's okay. If I was just looking at number 8, generically speaking, as we talk about policies and policies moving forward, right? I don't have my bylaws with me. Do the bylaws specify what kind of votes required to adopt policy for the council? And are we gonna restate that in it? Is it gonna vary? Now, this particular policy is a requirement in statute because it's a remote meeting policy to have a public hearing before you adopt a policy. That's a little bit unique, probably in the policy development.
In order for any of the members or the committee as a whole to meet remotely, there needs to be a policy adopted by the committee.
Right. My point is I didn't know if,
His point is the number.
The 3/5 vote is a fundamental.
yeah, so you're looking at a guy who has 109 policies on his desk,
Yeah.
right? And we don't restate in every policy that this is what we have to do to change the policy, if it's stated elsewhere, like in the bylaws. So I just didn't know if a reference to Maine law, in other words, is this a unique requirement? I don't have my bylaws with me, I apologize. The 3/5 vote, I assume, is a requirement that's in the bylaws for any policy adopted.
It's in the memorandum of understanding.
Yeah.
MOU.
Yeah, it's in the MOU that established the
Yeah.
council.
So in other words, it's probably redundant, doesn't need to be there.
Well, that's what I was thinking, but I don't,
It's there for, if folks want to strike that, happy to, I included it for clarity. But
that's okay. I just know this one was really.
I'm just wondering if we can figure out by not, I don't think it needs to go back to the governance committee because it was drafted by Randy. According to our instructions.
Correct.
He did exactly what we asked him to do. The only hangup we had today is that, probably prudent to allow to deal with this public hearing issue to adopt the next policy, but I wouldn't want it if it turns out that we don't happen to have a governance meeting between now and the next council meeting. I don't, this one should be simple. It did exactly what we asked it to do. It's gonna make it easy, life a little easier for all of us, particularly if we're traveling somewhere, not to have to miss a meeting. So I'm just saying, I don't think that you need to take it back to governance committee, as far as I'm concerned, as a member of the governance committee. I don't need to see it again.
Agreed. I agree. That's 3/4. So, because the governance committee, you're right, gave the instructions for this to be written. At this point, what we're gonna do is we're just gonna put it on hold till you clarify and get the public hearing in place, and then we'll vote on it. Whenever we can get.
Right, at the next meeting.
Okay.
Will the hearing be at the next meeting?
Yes, that's my goal.
Yeah.
You notice it in accordance with follow, you tell everybody, this is, part of the meeting. There's an X period of time for the public to comment on the remote meeting policy. And then the committee considers those comments and considers the policy and votes on it.
Okay. Any other comments? All right, we'll move on. Thank you.
And, if you have edits to make or, anything, just let me know.
All right. Administrator contract. So you all got a copy and a couple drafts were sent to you via the email, and I appreciate, as I shared, I think it was Chastity at one point, most of you commented, so it was great, and trying to incorporate all of the great suggestions at once sometimes gets blurred. But one of the things, and I believe it was Ben who brought it to the attention, is it broke it down into really looking at two sort of different kinds of positions. And So one of the things we have to decide on is, what are we exactly looking for? Are we looking for someone who's an operations manager or someone who does more administrative pieces? And each has different skills versus why you have two job descriptions. I certainly can see both pieces. I have strength in each, but again, it is the committee that needs to discuss this and make a determination as to what they're looking for. Again, one is more administrative, and one is more strategically planning based. And so I'm just opening the floor for discussions on that. So you have the job descriptions of a council administrator, and you also have one for the Maine Recovery Operations Manager. Yeah.
Before even getting into any of the depth stuff, because this drives me crazy. In both of them, it goes back and forth multiple times, spelling council different ways, and there's other typos, so can that get fixed?
No, these are just drafts, so I didn't the last time because, again, they were just drafts and I was combining 5 different people in there. And so that, today's discussion, spelling and the use of words will be, before you finally agree the job description will be approved. But today's discussion really is determination on, and I appreciate learning details. Today really is about the discussion is, what does this committee need for support? Do you need something that's more administrative, or do you need something that's a little bit more strategic? And that's the real question today.
That seems like a difficult question to answer.
It is.
Right? Not knowing, not fully understanding how to work.
Okay.
There's a lot of moving parts, a lot of things happening. I don't know, that just seems like a tough, I mean, and again, not fully understanding the AG's role, obviously, and other folks, within the state, what their role is gonna be within supporting the council, so. I personally was just still piecing that together.
Yeah, so, Gordon?
I agree. That's why, given that we've been supported in both roles really by the Attorney General's office, I'd like, if it's not inappropriate, I'd like to ask our counsel from the Attorney General's office to give his opinion on the issue, because he's more aware of what the Attorney General's office can do for us administratively and strategically. And so I think that's reasonable to ask what the opinion of the Attorney General's office is as to what our needs are, because they know what needs we have that they can support.
Let's see.
And it's, it's a little bit, it's a little bit of chicken and egg, I think, and I'm just sort of talking through my thoughts, so I apologize if they're not as coherent. I think from our perspective, we were, interested in seeing what the council needed and wanted, and trying to support the council in what the council members determined that it needs in order to implement its duties as we've described them. We have we have a role under the MOU, the 2 MOUs now, to provide administrative support and legal counsel. And at this point, in terms of administrative support, we're setting up the meetings, running the meetings, making copies, distributing things. We've got a website, we just redone our website. You should check it out, it's really great. We don't have, at this point, anything like a executive director type position who, anybody who, we don't have a substantive policy focused, sort of high-level staff position that is not, you know, that has the sort of substantive background that in either grant making or in, you know, opioid crisis abatement, or both ideally, that, you know, can help the council set up and run, you know, process by which to distribute its funds and to identify what the needs are around the state, to, you know, to help it put together its mission, to help it determine, you know, what its priorities are going to be in this year or in next year. So we don't currently have that level of person in our office. And so I think we were interested in hearing from the council about what council's needs are. You know, the contract idea, bringing somebody in who you know, has that expertise to help the council is, I think, something we want, you know, to hear a lot about. And I saw a couple of minutes here.
Well, when it comes to priorities around the state and whatnot, I mean, I figured that's why we're all here. It's because we're all, I mean, pretty much experts in our field and know what's going on. I mean, that's why we've had these folks coming and presenting to us. So I don't, maybe for other things, but I don't know about spending money to pay someone to tell us where we, you know, what priorities are. Because that's what we're all doing. I could be wrong. That's just my thought process there. Administratively, you know, I don't know. You guys are doing great. I don't know how much access or how much availability we have, but I mean, I would be leaning more towards that role if you guys need help. But in terms of, and then that's why we're going. Some of us are going to be going, or not us, but some council members are going to be going to Massachusetts and seeing what these other states are doing. So to spend, you know, however much we're going to be spending, I have no idea. I assume it's going to be quite a bit. That could be money spent towards saving 5 to 10 lives. My thought.
Thank you, Miles. Can I just ask, Miles, for clarity, are you saying you're leaning more towards the administrative role?
Yes, correct.
Okay.
I would be.
The question I had is, there doesn't actually seem to be that much of a difference in the minimum qualifications of both roles. The only difference that I see is the operations manager has grant writing experience and the council administrator has strong proficiency with Microsoft Office tools, including the ability to collect, organize, and present data, blah, 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 pretty much using Google Suites. But the positions almost look the same, except the only difference is that, I'm done talking out loud, is the strategic plan for the Maine Recovery Council. The one question I had though was, can someone explain to me why there isn't a compensation like range on this? Like, am I paying $200,000 for this and $50,000 for this? Like, it's hard to make a decision.
Yeah, there's nothing on there because you haven't really defined what the position is to determine the stuff. But one would be more costly than the other.
How much more costly?
That I don't know. I haven't done a salary.
Which is more costly?
The one, the administrator may be a less than an operations manager.
So, I mean, just to, I actually don't think, I think we can have sort of both. I think when we're doing interviews, I think we're gonna have to clarify this for actually the roles and responsibilities, but I don't think we need to like, totally, decide right now. When I went through it as well, I think I completely agree that the minimum qualifications are almost exactly the same, but what my suggestions were, I saw, you know, in the operations manager is establishing and managing a 3-year strategic plan. Like what Miles said, I would think that we are establishing the strategic plan, and I suggested that we change that to support implementation of the plan that we established. So it's more of a implementation and carrying out the direction of the council as opposed to, and also it says managing the fiscal components, and I changed that to support the financial. It's more of a support role of the council as opposed to empowering the person to go up, like, they're not making decisions, obviously, I think, and it was more of a semantics change, and I think we want something between strategy and administrative. I think we want someone to do everything, basically, and I do think and I don't want to prejudge what we're gonna do here, I do think we're gonna need to hire another organization to do everything else in terms of advertising and administering all the contracts or the reporting requirements, so that this is just gonna be the first, like, there's gonna be more support we bring on, I think, through, to do all the work and get millions of dollars out to the communities that we're here for, so, someone that's a sort of that can do everything is what I think we're looking for, and I think, we can edit the response. I think the person that interviews or who we hire is going to be interested in the responsibilities. I think we probably make sense to focus more on minimum qualifications, like you suggested.
So it sounds like what I'm hearing is that we're looking for an executive director that's going to implement. We are, like in the traditional nonprofit world, we are the board who hires the executive director who implements our direction. Is that correct?
And the executive director, and like in most boards, brings the information to the committee for the committee to make those decisions. And so again, the hard part is that there are some positions with an executive director that doing everything is included, and there's other things that look at the executive director and says, not my job to empty the wastebaskets. It's not my job to set up meetings. And so part of the issue is the more that we become involved in subcommittees. I mean, Ben and I had a short email back and forth about subcommittees and who's going to set those meetings up. Are we going to individually be responsible for setting those up, or does those all have to go through the AG's office? And the more that is, there's 3 subcommittees, maybe even 4. That's 4 meetings a month that have to be set up. Zoom has to be set up. Notices have to be sent out, and all of that. So there's a lot. There's a lot of administrative piece, but we're also looking for somebody who's a researcher, who, if the committee says, okay, how do other groups, set out grants, and how does that look? Do we hire outside for somebody to do that? But we make the ultimate decision. If I use the example of the city of Bangor took their ARPA funds, paid the United Way to do them, and the city council ultimately made the decision. All the United Way did was, we reviewed them, we scored them, here you go, and gave them all the input. Those are just things that are out there that we have to get here to make those decisions. How will we do that? No, we don't like that model. We want this model, but we don't even know what model that is. And again, to Ben's point, we have to look at, before we can give out money, what do contracts look like? Who's going to administer those contracts? This is a lot of money. You can't just hand people a check and not expect who's going to be accountable for that money. And again, getting all of that work done. But part of that is to start getting committees to meet. For instance, that finance committee to meet, to decide how much money are we going to give out each year? Going to give out one lump sum? Is that money going to be given out yearly, 2 years, 3 years? There's a whole lot of questions here. And do we need somebody who can, again, as Courtney pointed out, someone like an executive director that brings the information to the board develops, makes the ultimate decisions on this. So that's sort of where we are.
Pat, is that your vision as the current chair? Because it seems like you're doing a lot of work as the chair, and to use your comparison to the board chair. If you were the board chair of your agency, what you wouldn't be doing? So what's your thoughts around?
So my thoughts are, I don't do a lot. I work mostly with the 2 of them. I have calls, and again, part of my role will be to serve on more committees. But my frustration is that I sometimes feel like way too much burden is put on them, and that I'm looking for more of a position that their only job, or they're being paid to serve the needs of this council, to get things out. And that's why I'm saying, I think that why I'm saying the position is only for a year, just my opinion, it's only a year position because we don't really know what this looks like. I don't want to commit to somebody for multiple years, because in a year we may decide we're a whole different place than we are now. I'm just looking, again, as Gordon said, when looking at Brennan and Haley, how much can they do, and are we asking them to do too much? Gordon and then Miles.
I think that mostly administrative for now, because the other tasks that need, whether it's monitoring compliance, whether it's evaluating something, whether it's scoring, advertising, all the things we've talked about, well, we can hire people or firms to do those things. I wouldn't call it an executive director now, because that, to me, that brings a lot of things into play, like an executive director says, well, that's not my job, now I need clerical people. No,
Correct.
we want an administrator. I think it's quite clear, I think many people around the table would agree, that Brennan and Healy are overqualified for a number of the things that we ask them to do. And it's not fair. We lose some of their expertise in the things that Brendan will probably have to have a role, frankly, drafting our contracts with people, unless we just go to a completely different firm. And even then, he'd have to review that. Because, I mean, we're not going to be separate from the Attorney General's office. But we want to operate as independently as we can and use them appropriately in the roles that their qualifications would call for. So I think, primarily an administrator for now. If the person does come in with other skills, right now, we don't have anyone that leaves this meeting and tomorrow morning at 8 starts again on our work because we sent them out to do, well, let's see what's happening, meet with the executive director. Rhode Island's Recovery Council does have an executive director, a different model. And so we need them a full-time, maybe we need more than one, but start with one really qualified person that operates under our general direction, specific direction with assistance from the Attorney General's office is what I think makes sense. It's hard to come up with a range of compensation, but I think once we get the role described and then that will probably come, it will probably come naturally. It's not $200,000.
Yeah.
And it's not $10,000.
Yeah, I'll come out of retirement for that one. All right.
Just to clarify, just a question, and I definitely appreciate all the work that you folks are doing. I was under the assumption that the portion of this money that came to us, doesn't that go to the AG's office to help get this going? Is that no?
Yeah. So under the MOU, the recovery fund is separate from the Attorney General's fund.
Okay.
It administratively lives in the Attorney General's accounts, and the Attorney General's office is responsible for the administrative functioning of the council. The council is authorized, as I recall, under the MOU to spend some of the recovery fund on administrative purposes. So in addition to what our office, provides in the MOU, the council, is authorized to spend some of the recovery fund on additional administrative support.
But there was no separate appropriation or funding provided to the OAG to actually administer this council.
That's right.
Got it.
Perhaps an oversight.
It's a very,
Well, that's what I was.
very good point.
I wasn't sure if.
And we have a limit as to what we can spend administratively with that money. There is it like, what do I think?
3% or something?
Yeah, there's a low percentage. We can't spend over a certain percentage of the money for administrative purposes. You couldn't hire some high-paid person within that. It's not within.
It's quite a lot.
It's quite a lot.
3% of 14 million is a lot.
It's quite a lot of money.
Yeah.
Because I want to say it's maybe 15%. It could be.
See, I don't know why I have 10 to 12% in my head.
Yeah.
I mean, do the math. I mean, 10% would be 1.4 million of what we have right now. I mean, we're talking about spending a
No,
tiny, tiny.
we're
bit,
tiny bit.
But you need to sometimes spend a little to.
Well, in order to move forward, I think we have to do something.
Yeah, I was just gonna say, I want this council to be effective and efficient, and if hiring this position helps us achieve our goals sooner and with more accuracy and attention to detail, I am all for it. The 1-year limit, the only caution I have with that is, are we ruling out candidates who would see a 1-year position as too much of a risk to make a shift? If we're talking about people with a pretty full range of skills in opiate abatement and grant writing. So that's just a question.
So the pieces we were hoping to contract with the person individually. The person won't be a state employee. So the person would be here on a contracted basis. So that was our hope, because that's the most efficient way to get a person on board quickly, is to not have them as a state employee, but have them as a contracted position.
We also don't have an option,
Right.
because the legislature needs to approve all positions. statewide positions.
So we don't even have that.
And could we maybe just be open to negotiating if that person was looking to negotiate what the contract length might be?
Yeah, I mean, again, we would probably know 6 months into, again, we could say that at time of interview, that it's 1 year because it's new, and that's the way it is. So if I'm hearing right, for the sake of time and for other things, what I'm hearing is, and please correct me if I'm wrong, I'm hearing that we're leaning more towards an administrative sort of responsibility. We still want them to have certain knowledge base, but we're looking more at that piece administratively to help us move along. We're looking at, you're looking probably something full-time, if not 3/4 time. I think that's what I'm hearing from people. And we can change these so it'd be a recovery council administrator versus more of a manager. They're not really managing people, all they're doing is really gathering information and bringing it to the council, and the counseling determining what they'll move from there. If I'm hearing that right, we can clean up these things and clean up the spelling errors and make sure that words are used correctly. We can do that. Ben?
Yeah, I agree with that. I just want to make sure we're all on the same page, because I would envision us like asking them to reach out to the Rhode Island Executive Director or, other states or municipalities within the state. So we want them to be able to function, obviously, with a pretty high level of autonomy.
Yeah.
So I wouldn't want to frame this as exclusively an administrative position, because that's not going to be the candidates that we're going to get.
You want somebody more than just somebody who can do it, to take notes.
Could I offer Maine Recovery Council coordinator as a kind of more middle ground space between quote unquote executive director and administrator? Because I agree with that. Not that I'm gonna apply for this, but I wouldn't apply for an administrator position at this point in my career, and I feel others might do that too.
So Maine Recovery Coordinator? All right. So I will do that, and I think I have Rhode Island's job description. Betsy and I were doing it, we asked the National to send us some job descriptions, and so there were some of them in there. All right, and I will, if anybody has any expertise on trying to look at fair salaries, I'd be more than happy to meet with them or talk with them over the phone to be able to put a range in there, but I would probably not be the person with the expertise to put a range in. I've been retired for 6 years, so I'm out of it. So I don't want to shortchange somebody, but I don't want to overpay anybody either. Our money, as Miles pointed out, should go to other reasons.
I don't have expertise in that. I just wanted to mention, we have like an ARPA manager, which in some ways, I know it's not the same, but in some ways it's like a chunk of money, a council who decided what the things should be spent on, and then somebody who's managing and supporting and getting all the information and bringing it to the commissioners to make decisions. And I can send you that job description of our wonderful administrator who's doing that. Her position is, she is called like ARPA compliance manager, so it is. But anyway, And you could also look at her compensation, the compensation range for
Yeah.
that, although you'd have to shift it for a consultant, because obviously you need to pay them more without benefits. But,
Because there won't be benefits.
right, and there maybe others have lots of other ideas about that, but it just feels like a somewhat comparable.
That would be very nice, Liz, if you could send that. And
Yeah.
then I will make sure that everyone gets a draft once we complete it.
And is this full-time? Or intending it to be full-time?
Well, yeah.
That was relative assurance.
Do we want to talk about compensation a little bit in general, so we don't go away and have to come back, starting from scratch next meeting?
Sure you can, but I'm looking at my time. So sure, we can have a short discussion on compensation. If you have ideas, we'll take them.
$40 an hour would be $83,000 a year, and there's no benefits with that, so I think that as a starting point, I'm sure we all have different expectations with compensation, but that is maybe a starting point to go higher or lower from there.
That actually sounds right to me.
Yeah, sounds good to me. Look how easy that was.
I sign a lot of contracts at the
You do, I knew there'd be someone at this table with this expertise. I live on a fixed income, I'm not the person to ask. Well, the government gave me a raise, so I'm happy. All right, so I will get you the revised job description. Liz, if you send me that, we'll look at that. I think that 40-hour range may be good for us. And so we can move on from there. Any other questions?
I think that send this out before the next meeting.
Speaking of the next meeting, we distributed, I think, a calendar of potential, the days with no slashes on them are the days where Brendan, Benedetta, and I will all be in the office. There's not a lot of those, so if you guys want to get one more meeting with the rest of us, it would have to be very early August.
So our next meeting is scheduled for the second Thursday, which would be August 17th.
The second Thursday is August.
No, the second would be the 10th.
Yeah, we just don't have Brendan around those days, so. There's no Thursday
do
this
you
month where
trust-
Brendan and I are here.
Trust us to meet without you?
Oh, no.
Well, if that's the
I'll go amok.
If that's the public hearing, that might be tricky.
Yeah. If
What
that,
about the 31st?
question about the public hearing.
You're gonna miss.
I
the
prefer
public-
not to be here for International Overdose Awareness Day.
Oh, yeah.
Is that the 10th?
We wouldn't want to.
The 31st.
Oh, the
I
31st.
mean, that would be, so let me just, like, for FOA purposes, we need to give a certain, unknown amount of notice ahead of time of the meeting, so, today's the 13th, meeting the 31st would be 2 weeks.
No, I think she meant 31st of August.
So,
Oh,
No,
maybe she
31st
meant,
of August?
maybe there's not.
so if no one minds waiting
I
for
thought
the
they meant
remote policy to go to
Thursday.
September, we can keep on schedule, which would meet August 10th, and then do the public hearing when you're around in September, at the September meeting, if that works.
Yeah.
Because in the meantime, we can make do with the policy we have.
You intend for that meeting on the 10th to be remote or in person,
It'll be a hybrid,
like today?
yeah. That makes, okay, all right, that makes sense? Do you trust us to meet with that?
I don't know. I may join remotely as well. That's part of because it is part of my job. But I will say that
You should stay on vacation.
I have to be mindful, there's good reasons why I have those days off.
So-
Anyway,
Well, let's look to see what's on that agenda and then before you go.
yeah. 'Cause
And
We
then
could
we'll-
look
I don't
into
know
just
what's on.
meeting the 31st of August too.
No, we cannot.
Oh, we can't,
No.
okay, it's that, okay.
It's International Overdose Awareness.
Correct, so,
Okay.
Week and
Yeah.
day.
What
that
about
on the
that
calendar.
week at all, like the 29th, the Tuesday?
we could meet the 8th of August. But see, the only thing is that you get off your routine.
Well, the 8th, either way, I think Brendan, oh wait, no,
No,
it's
I
the
can do
9th,
the
okay.
Oh, I can't be there that day, but,
We just wanted to highlight the issue, we can resolve it over email.
yeah, we can resolve it over email. In the meantime, we'll meet on the 10th let's you and I talk about what will be on the 10th meeting, and meanwhile, we'll keep it on schedule.
And in general, my expectation is that we would schedule meetings in a much smaller room going forward.
Okay.
Unless this group tells me that you actually do plan to come mostly in person, in which case we'll continue to try to schedule it here. Smaller or this room?
How small?
Maybe like where the governance committee meets.
Yeah.
No, I don't think that's a good idea. The public's gonna get more and more interested in this space.
Yeah, the more you bring in, yeah.
Okay.
Keep this area.
This space work.
Keep it here?
Yeah, keep it here.
Okay.
All right, so for the sake of,
Is there a time, we settle on the time?
Standard time.
That's fine.
Well,
Sometimes it
what is
gets,
standard time?
sometimes there's meetings in this room till a certain time and I have to push it back an hour or so. I try to schedule us from 2:30 to, or from 2 to 3:30. But sometimes I have to push it back just because the room is already booked till like 2 or 2:30.
Can we book the room the rest of the year at standard day and time?
Yeah, good.
Try and avoid that.
It's the second Thursday. is
Yeah.
what we're shooting for.
Yeah, I can just have a booking in for the second Thursday.
I can help.
Okay, I mean, I think that's an option when I go to book this room anyway, it's just like if we're currently.
okay, so,
While we're talking about scheduling real quick, is the hour-and-a-half meeting working for us? Because I feel like we still have a bunch of things on our agenda and we're not gonna get to them.
That's
And
all you
also
guys, if you wanna meet
feeling
longer,
antsy about getting this money out
then I will
and
be
like
here.
all the things.
yeah, it's getting tighter and tighter because things get thrown on there. I mean, I don't object to a 2-hour meeting, but I think we compromised it an hour and a half.
I just think that problem, agreeing with Courtney, that for me, I only live in Portland, it's 2-hour drive for an hour and a half meeting.
Oh, yeah.
So I think it's, goes by really fast.
Yeah,
It does.
I'd rather have a 2-hour meeting, and if I'm gonna drive all the way
So
here.
let's next month schedule a 2-hour and see how it goes. Can you book us for 2 hours?
Yeah.
Thank you. All right. So I want to quickly talk about the governor's conference. The governor's conference is on July 20th, and that we are scheduled in the afternoon, I believe at 3 o'clock, to present. What I need to happen is, so Brenda and I sort of worked through with the Attorney General's office a quick agenda. So it'll start with Attorney General Fry will actually talk about his work for about 5 or 10 minutes. Aaron will speak. And then there will be about a 10-minute brief introduction of the team. Each member of the council who will be in attendance will introduce themselves and say why they're serving, who appointed them to the council, and a short thing about themselves. Brendan will then talk about 20 minutes about the MOU and how that works and how the money flows. I know all of us have seen it a couple times, but the general public has not. So we're gonna let that happen. And then the final 20 minutes, there'll be a discussion with the panel, with the Recovery Council, where the audience can actually ask questions about the work that we do, how they see it. They can give some of their opinion on what they see or how they see money in their communities going and how that works. So that is sort of how that 60-minute, 1-hour presentation will go. I just need to know from all of you who is attending and will be willing to serve on that panel that day and who will not.
What time did you say it was, 3?
3.
Did you have an, sorry.
I think this is Gordon's show, so.
Yeah, it's Gordon's show.
I'll join.
I mean, anybody that's gonna be there, we hope that you come by and be part of this.
Yeah.
So,
I mean, I'll be there.
it's about, looks like 8, it looks like,
Oh, everybody, excellent, well, that is excellent, all right.
I just
So-
wasn't sure what, I didn't respond because I planned on going to the summit.
Yeah.
But I didn't, it sounded like you had enough help. I didn't know whether you wanted us all.
No.
I don't mind, I was gonna attend the session.
I think it's important to, let me say a couple things. Number one, this session is in the arena itself. So while all the other 9 competing breakout sessions will be in other rooms, you're one of 2 breakout sessions that will be live streamed and is in the arena. So it automatically gives you, well, number one, we need to be cognizant that there could be a lot of people watching remotely. Secondly, it means that you'll have more people even than you normally have, and we get 1,200 people around, so almost all the sessions are well attended. But I think this session and the session with the Jackson research teams, talking about current research, NIH-sponsored addiction research, NIDA, that's a popular session, so we've left that in the arena too. So you're kind of the default session. Everybody else in other sessions, they go into other rooms at the Holiday Inn, Maine Health, and in the arena, but you'll be in the arena. I think that it's really powerful, the more of us that are there, so that, because people will identify and say, oh, I know Miles. So if we're all there, then I will tell the people that I work with there that I want 15 chairs for that session on the stage. And we have, obviously, Brendan and the Attorney General as well. And I also think it's very powerful to have the Attorney General staff session. You know, it's his office. But for his office, we wouldn't have any of this money. And so he can set the tone, and then, but I think all of us introducing why you think it works, why you're interested in it, who appointed you. Yeah, it's gonna take half the hour, it's gonna go very quickly, but I think it's important.
So you just need to know, so you know, I have to submit tonight a bio and some documents in order for CEUs to be met. So I'm not asking everybody for a bio. Brendan and I just said we're gonna submit ours and the Attorney General's so that people can get CEUs for the session. So if something is in there, it's not that I left people out, I don't need 15 of them in signing. So that's sort of what we're gonna do in order for people to get the CEUs. But we had to do that. And then we do have a PowerPoint that will be part of the presentation.
And if it, just real quick, if it makes it easier or more efficient, one or two of the slides, I have, you know, the council members and the positions that, you know, the positions under the MOU and the council members.
That slide should be up.
Yeah,
Correct.
I mean, we put the slide up, you know, we could do, you know, well, I guess everyone's gonna be up on stage, but like, you know, so if you wanna save like a round robin of introductions, but it's up to you, you know, I just am telling you that those are that's gonna be a slideshow.
But I just found that piece of thing out on Tuesday, Wednesday, that we had to submit the bios or people won't get CEUs, and at first I thought, well, and I know people's CEUs are important, so, they're super important people, so I gotta get that, so make sure that that gets done. And there's some documents that have to be signed, so, we will do that for everybody, all right.
Jess.
So it's short notice, so I don't know how great this can be done, but it feels like a missed opportunity to not do some sort of questionnaire for folks, whether it's printed or there's a QR code that people can scan to give their input on the council, what their priorities are, what they'd like to see from us. Because that's a lot of people in one space that are all involved in the work, and to not utilize that is a missed opportunity.
That would have to be a Gordon question, logistic.
Well, we already have some QR codes operating that day on the strategic plan, so we can probably I can probably take care of that and just have it as a handout for people for that particular session. The real question would be, should we have that in the bag that we give to all 1,200 people?
Yes.
Or should we have it just for our session?
I think in the bags.
I'll take it.
Thank you.
Great.
And Chelsea, what are you envisioning, like, questions to be?
Just what people's priorities are for the council, of course, we're spending money on, like, people wanna see detox, they wanna see SSPs, like, to hear from everybody what their priorities are, 'cause that's a diverse group of people.
Do you wanna,
Open-ended or closed?
right, I was gonna suggest categories,
Mhm.
you know, like the sort of 4 pillars,
Mhm.
you know.
So maybe it's a lot to figure out over email and like 24 hours to get it together, but
And also,
Try.
it's possible, you know, another option could be to utilize the Recovery Council's website, post something on it there and direct people to it. And that buys us a little time or whatever. But just
Because we can, during the presentation, do that, say this is our website.
I still think we should try QR code.
Okay.
People are gonna be more apt to do that.
I could see maybe a one-page, two-sided, drawing copies of it, QR code, 3 questions, and the names of all the council members. Something like, and a website, for sure. That I could handle in 24 hours, if you send me the 3 questions. I mean, that'd be pretty, what do you think the priorities should be, council? Is there anything else you'd like to have this council know? They can be open-ended because of the QR code.
I would just recommend that we make sure we put where people are, because I think there's really big differences, and I wouldn't want to miss that of where things are missing, where people's priorities might be different across the state.
If they identify, if I say my community doesn't have a detox,
Yeah.
where am I
Yeah, just
from? I'm
geography.
from Washington County, I'm from,
Oh, we can, we'd like to have at least one demographic question where they wouldn't have, we can have the name be optional if they want, but we need to know what town or county, whatever they're familiar with.
because they could have services, but they don't know they have services, or they don't have services.
I mean, I'm just trying to keep it simple. I mean, this thing is 24, we're gonna be doing this 24 hours, 7 days.
7 days from now.
Right.
Which brings me to another subject. The NASP conference in Boston, we can only send 3 members right now. Gordon is one of them, so we have 2 spots. Now, they have told us, as registrations come in, if every state doesn't send 3 members, then we may have some more. But I just need to know who are the, again, you're welcome to attend the conference. It's this one session, that one day, that we only can have 3 people from Maine in that.
And the council itself, we're covering the cost of those 2 additional people. And then we could have alternates as available if the spaces open up. I don't see anybody staying for the whole national conference. I mean, that's a wonderful thing if you're involved in healthcare. It's great if you do, but we're mostly interested in Monday's morning and afternoon session.
What's the date?
15th?
No,
It's the 14th of August.
Yeah,
It's a Monday.
It's a Monday.
I mean, I would love to go if possible.
catch.
Liz?
I mean, yeah, but I would defer as well. For me, there's a part around the local stuff. It's like a dual thing that's helpful for me, but again, there might be others who want to go.
Didn't you talk at the last one that you wanted to go to?
Well, I was gonna go, but, you know, I want people to be able to hear and as well. It's not just essential that I go. I want people to hear from other states. So Paul and Liz, Gordon's going. All right. Anyone else? I can put them on an alternative list.
I would defer my spot to you before I go.
I'd be stunned if we tell them we've got 3 additional people to me. We know these people, we know that, we know.
All right, so you think we can,
Yeah,
so Paul, Liz, anyone else?
Just,
I'd like to go if there's room, but I don't want to be like the kicking anybody out of the.
Okay, so Courtney, let's talk to them and see what we can do. Just say we're desperate.
Well, we're so close.
Yeah.
well, and we're paying registration fees for, for
Yeah, we're
that.
paying for it.
And
Yes.
the cost.
14th, not the 21st, I thought
It is Monday. No, I'm pretty sure.
Boston is the 14th of August,
Monday.
Monday.
Yeah.
It's got they're putting us up at the location, which is the Copley Marriott, I think.
Yeah,
It's,
so we'll spend one night at a hotel and then we'll pay mileage.
Well, they're putting me up for Sunday night, Monday.
Oh, okay.
I just want to stay somewhere and come home on the train.
Yeah.
Yep.
All right, let me contact them and then I'll contact members and let them know where we are. Or now put the pressure on. All right, what else was on my list? I am going to send everybody a letter that the Attorney General and I received, that I think should go to all the council, from Health and Human Services Committee members sent us, which was very interesting. They had on here thanking us for our work, but also telling us their priorities, what their priorities were.
We don't have that letter.
Where's that?
No, I said I just got it.
It
So
just
I'm
came
gonna-
in, we'll circulate.
Yeah, I'm gonna circulate it to everybody. No, I just got it. I said I was gonna circulate it. But I wanna tell you, one of the most interesting things I found on here is funding and encouragement for the establishment of a substance use disorder research center within the University of Maine system. I've been in this field a long time. I don't think I've ever heard a legislator suggest that we need to do research and put some money and investment into research into this illness. I was blown away by that. But again, there's most of the suggestions on here are things that certainly we've heard of before, some LDs and some other stuff, but everybody will get this letter. It was sent to Attorney General Fry and me as chair of the committee, but I will make sure everybody gets a copy of that.
Would you pass it around real quick?
Yeah.
And we will be inviting, usually about a week before, once we know the legislative schedule. The governor will invite every legislator to the, I think you're coming in, aren't you coming in Wednesday? Maybe? You don't know.
You shall
So,
receive.
but anyway, we don't want any legislator to think that they're not invited. So everybody will get, and the legislators don't have to pay either. So we'll be inviting everybody.
So, the one more thing that I want to discuss before we end this meeting, because we're already over, is committees. Almost all of you have signed up for committees. There's a few members who have not. And I will have a chat with you and ask what committee you'd like to serve on. But I'd really like to start moving on those committees, and so you'll be getting some emails from me about trying to organize to meet at least once before our next meeting, the subcommittees, which are finance, governance is already moving and established, mostly the finance committee and the grants committee. Those two committees, I would really like to start meeting. And again, for the sake of lots of things, you can do it completely Zoom. But we just, again, everything we do is public. So we have to have lead through time. So I will be out sending some information about who's on what committee, and I think you got that memo, who signed up for what committee. If you want to certainly get a hold of me, if you spoke too soon and you don't want that committee, let me know. But I'd like those committees established, and also each of those committees will have a chair to them. It doesn't necessarily, not looking at it to be me. For instance, Ben, as treasurer, will serve on that finance committee. But I'd like those to start moving forward, particularly because that's where a lot of the nitty-gritty work will be that's brought forth to the committee. So I'm sort of putting out a challenge to this group that they try to meet once before the next meeting, if not even just for an hour via the Zoom, just to start establishing some of the roles and goals that you have for that committee and assigning a chair. And all of those committees, you'll have to assign a secretary, somebody to take notes, because those will have to be public and placed on our website, as well as distributed to the rest of the membership, because not every member is on every committee.
So if we meet, the meetings have to be recorded and then put on our website, is that how that works?
The meetings will be the public can attend your meetings, actual meetings, like they do this one.
Got it.
Yeah, and there has to be a sufficient amount of public notice in order for that to be established.
That's why we need an administrative.
Correct, there you, it's like, you know, and again, I don't want to ask somebody, for instance, one of the things Ben and I briefly were back with an email about his chairing the finance committee, but, you know, he's saying, do I have to set up the meetings, do I have, again, we can't certainly ask people who are already quite busy with their own jobs now to do this whole thing with setting up meetings and setting up the room and making sure the notices are sufficient. So again, more and more reason why we need an administrative person to be able to move us forward. I have in my head that I think we should get an MSW intern. Uh,
I have a question. Was this meeting supposed to be at 3? Like, is it normally at 3 and it's at 2 today?
I think we moved.
We usually try to do it
What
2 to
time was this
3:30.
meeting? I thought it was at
I had-
3.
I
On the
had my
agenda,
vote
it
from
says
3 to
3.
4:30.
I did too, until my staff like.
Wait, what time did this, did I miss half the meeting?
Yes.
On the agenda, it says 3 to 4:30.
Oh, my God.
I think when we did the survey,
This
when
is
we
2
did
to
the
3.
survey, people were asking
Yeah,
the
it should
meeting
say
to
2
be
to
earlier.
3:30.
Yeah,
Yeah.
so it's 2 to, yeah.
Did you have it as 3?
I had.
I had it as 3.
I had
Okay,
it as
so my
3
staff
because
said it
of
was
last
like
time when we said. it was
Last time was one of
recurring.
those times where there's a meeting already in
Yeah.
the room, so I couldn't book
Oh my
us
gosh,
at
I'm
2
so
like I
sorry.
usually
So when we
thought the
did the
meeting- I
survey,
thought
so
the
your
meeting was at
meeting
3.
normally
No, you're
is
good.
at
That is
2.
true.
Sorry.
Well, good, I'm glad
I
I.
had a little holiday, and I looked 3
So
times.
when is
So
the
how did
meeting
that
get you
happen?
next time?
2.
2 o'clock.
As long as there's not a meeting in this room, I haven't booked it yet.
Okay.
And we can work with them.
Yeah, but I am going to book the next, I'm gonna book every Thursday through the rest of the year.
So then
At 2 o'clock.
What?
At 2 o'clock.
At 2 o'clock.
As long as the room
So
is
we will
open.
know when.
For 2 hours.
2 is the norm. Oh, for 2 hours.
For 2 hours,
You
we're
wanna
gonna
make that
try
the
the
norm?
2 hours and see what happens.
That's what they said.
Okay.
I thought they were just trying that for
No, no.
this meeting. I didn't know.
Well, I mean, is it,
Is it 2 hours from now on?
Well, we're gonna try it, because we're really feeling rushed, that we're not getting everything we need to do, and so people have requested, because if I remember the debate right, we were in the appropriations room, people thought an hour and a half, no, they wanted, first, people wanted 4, and then they went to 3, and then they compromised at an hour and a half. And I'll tell you, to chair this meeting, I feel like I'm pushing everything forward, and it's not a comfortable feeling for me to like, okay, cut off, move to the next thing in order to get everything on this agenda that needs to get done. So,
But can Haley just schedule 2 to 4
it's,
for the rest of the year?
yeah,
Okay.
that's what we're aiming for,
the second Thursday?
second Thursday.
I'm so sorry, but I really feel badly that I missed
We were
that
fine.
meeting.
No
Yeah.
apologies.
I
If
really,
anything, like,
like,
if,
set up my whole day around this.
you know, if there was confusion, you know, we'll have to look and see how we can make sure we're
Yeah.
more clear in the future.
So for the opioid conference, just to go back real quick, do you need us to do anything? We don't need to send you anything? We just have to register?
Yeah, you all have to register, and if you're a panelist, you're
You
free.
should all register as panelists. so you don't
Yeah,
have to
all
pay-
register as
pay-
panelists,
so
because
you
it's
don't have to
free
pay
if
the
you're a
fee.
panelist.
Unless you want CEUs.
So
No.
Gordon, I wonder if Gordon,
You need
can you
to-
like smooth the path about not needing bios and forms?
Yeah, okay.
Oh, you will take care of that?
Well, you need to send yours and
Yeah.
Brendan, you've got that.
But like-
That much, and
Yeah.
I'll take
Okay.
care of the rest.
Yeah.
All right,
You truly do.
I-
We
Again,
just don't want to, we don't want to cause problems with people's continuing education.
yes,
No,
and that's
you
why.
won't. No, it'll be okay. It's complicated.
Then I didn't want to send in
Because
15
CEUs are
bios.
different than CMEs, and now one of the lawyers wants CLEs, but the fact is you don't, if you have 15 panels, you don't need for approval everybody's bio.
Okay.
But you need your primary people. Yeah, Lorraine will set it up.
Okay,
But send them what you can.
okay, I will do that tonight if I get my computer up. All right, and I have yours that you sent me, right?
Yes.
Okay. All right, I have that. All right, any other business to come before the meeting? I apologize if you're rushed. Again, I was so happy when Director Squirrel wanted to come here and answer the questions, and I can tell you, just thrilled that it's their priority list, and I think it's one of those things that we can look at and discuss amongst ourselves, if we're interested in joining that or not, but I was very pleased with the fact that she answered our questions so quickly. She's a busy lady, so. All right, there's no other business before, I thank you all very much. And thank you online, thank you, people.